Good afternoon, everybody. This is Geeta Tyagi. It gives me great pleasure to introduce the keynote speaker for the Bangalore Tech Summit, Dr. Indu Bhushan, who will address the digital health stream today. Dr. Bhushan is the Chief Executive Officer of the National Health Authority. NHA, as it is called, is mandated with the implementation of Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana. More recently, with the announcement by the Prime Minister on the 15th August, NHA has the dual mandate to implement the National Digital Health Mission, or NDHM. The aim is to create the integrated digital health ecosystem for India. Dr. Indu Bhushan is a civil servant turned economist. He was recently selected for the Global Achievement Award by Johns Hopkins University. On behalf of the National Health Authority, Dr. Bhushan has been awarded Government of India's National Award for E-Governance, a Gold Award for Excellence in Government Process Reengineering for Digital Transformation for Ayushman Bharat, PMJ. Affordable quality in itself is an oxymoron, and more so in the context of healthcare. Dr. Bhushan, in his keynote address today, will speak about how NHA is building the National Digital Highway using the power of IT to overcome the many challenges inherent in the ecosystem and facilitate affordable quality healthcare for all Indians.
Good afternoon, everyone. The world today is moving towards a new normal, a new way of living that we are all accepting in the shadow of one of the most life-changing periods in this century. The ongoing COVID pandemic has been nothing but a big tragedy for people, economy, and society. We have lost thousands of lives and millions of livelihoods. Things have been far from easy, and we know that more challenges lie ahead. We treated this pandemic seriously and adopted an approach that many others today regard as an example. COVID has given us some lessons and provided impetus for long-standing reforms in the field of healthcare, none of which is possible without leveraging the power of technology. We have to carefully learn from each lesson that the crisis has taught us and evolving a more empowered healthcare ecosystem strengthened with digital opportunities. As Churchill very famously mentioned, never let a good crisis go to waste. I'm not sure whether it's a good crisis, but the key message still remains. Even this summit happening virtually, who would have imagined 10 months back for this summit like this? The pandemic made us utilize the power of digital communication, and today the world is clearly seeing the potential of virtual meetings much more than what it was just hardly 1 year back. I'm sure that the new normal is here to stay. Even after we have defeated the virus, we'll see many such meetings, conferences, and summits being held virtually, being a lot more efficient, saving time and resources, carbon footprint, and expanding the reach of ideas to a much larger audience across the world. Seizing digital opportunities in healthcare is the way forward for the sector. Healthcare has become one of India's largest sector of revenue and employment. From hospitals, medical devices, clinical trials, outsourcing, telemedicine, medical tourism, and health insurance to medical equipment, the health care sector is growing at a brisk pace due to strengthening coverage, services, and increasing expenditure by public as well as private players. What needed is the right use of technology, empowering and strengthening systems, and moving to a standardized healthcare ecosystem. Like I keep mentioning a lot of times, we need to make India a digital health nation. And I'm not just saying that as a thought. This is what we have lived by at National Health Authority from day one of its existence. I personally believe, and we've shown this through results, that the role of IT in improving quality healthcare is extremely critical. We first, of course, need to acknowledge that a well-functioning health system is built on five things: trained and motivated health workforce, a well-maintained infrastructure, a reliable supply of medicines, backed by financing, of course, and strong health plans and evidence-based policies. But at the same time, the power of technology is extremely critical to make it all work and achieve providing quality healthcare to 1.3 billion countrymen and women. Despite multiple initiatives in the recent past, the health system in India needs to be strengthened further, and we need to improve access, affordability, and quality of care for citizens. In my view, building digital commons can improve healthcare delivery and health outcomes in a big way in the country. This is just how we leverage technology to its best for providing equitable healthcare facilities through health insurance and assurance for more than 500 million people under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, and how we are doing this under National Digital Health Mission with creation of digital infrastructure, which is going to be seen in the next few years. They'll catalyze a highly robust Indian digital healthcare ecosystem. First, Ayushman Bharat PMJ. It provides secondary and tertiary care covering the poorest citizens in the country, covering about half of our population, through an assured annual health coverage of 5 lakhs rupees over to over 10 crore families. Given the ambition and complexity of this scheme, which is connecting more than 24,000 public and private hospitals in every corner of the country and linking more than 50 crore people, we couldn't have achieved this without robust, powerful, and secure IT framework. Using this framework, we have provided more than 1.4 crore treatments worth more than 17,000 crore rupees. Today, we have a comprehensive IT-based solutions that are designed to help our states and partners in rapidly implementing and scaling up the scheme in an extremely user-friendly manner. Our beneficiary identification system is undoubtedly one of the biggest beneficiary databases in the country and the most powerful one. It has the capability to identify, verify, and validate a beneficiary from over 500 million individuals in less than 1 second. It's like picking up a needle from a haystack. The process of hospital empanelment under PMJ has been automated and works online. It ensures complete ease of doing business for hospitals to become part of PMJ. Over 24,000 such hospitals, nearly half of them being from private sector, are today empaneled using the system in a 100% online paperless fashion. Most importantly, we built a 100% online transaction management system, which allows for capturing of inpatient data on admission, treatment, and discharge, and onwards to the claim processing and financial settlement with no paper movement at all, working fully electronically. Believe it or not, we don't move one piece of physical paper and remit the money, which is about 17,000 crores, for treatment to the hospitals in a completely electronic and automated fashion, with our system being linked to every bank in the country. Having such easy to access and highly user-friendly system does not compromise on privacy and security. We take care of end-to-end information security and privacy of personally identifiable data for beneficiaries. We ensure portability, we ensure grievance management and anti-fraud measures using this IT framework. Our knack for technology continues with our extensive use of artificial intelligence and machine learning to detect and prevent fraud and abuse. Our system uses a wide range of fraud analytics tools and methodologies to understand what happened, why did it happen, what will happen, and what is required to prevent an undesirable outcome. Ayushman Bharat also has a completely online Central Grievance Redressal Management System, CGRMS, which helps in providing efficient, transparent, and speedy management of grievances in a time-bound manner. Another area in which IT has helped the scheme is monitoring and evaluation, which is key for its successful implementation. Monitoring of PMJ is a complex, multidisciplinary, and skill-intensive activity. This provides the management and key stakeholders up-to-date information about the progress made and existing gaps. We have a live dashboard with key performance indicators from the day one of the scheme's launch. PMJ is arguably the first healthcare scheme of India, which is data-driven from day one of its launch across the country. The system allows real-time monitoring of every transaction, every treatment, and every specialty under which a benefit is being given. It allows not only monitoring, but also analytics on which health benefits is being utilized more, in which part of the country, and for what specialty. Such analytics is done on variables such as age, gender, income groups, and others to have a clear understanding of health financing and use of services. Furthermore, we also leverage technologies to assure quality of services under PMJ. We have developed standard treatment guidelines and workflows for most of our benefit packages. Our IT system ensures that implementation and adherence to these standard treatment guidelines is done. No payment if the guidelines are not being followed. One important element of our IT ecosystem is integrations based on open API framework. We have a gateway that integrates all PMJ applications within the IT landscape, as well as all external integrations. Existing PMJ applications interact with each other and external systems like Aadhaar, state systems, and others using this advanced gateway only. Taking our technology-based empowerment journey forward for PMJ, while we already have a robust IT system in place, we are planning to further improve it, and we call it PMJ IT 2.0. With this, we aim to make IT system of PMJ not only best in the country, but best in the world. We are also planning to upgrade the IT framework and lay the foundation for health insurance IT ecosystem for the country. As a nation, today we have the opportunity to build on and scale these innovations and fundamentally transform our healthcare system. Multiple examples from India and other countries underscore how a robust digital public infrastructure can create a fertile environment for consumer-centric innovation, bridge the need gap, and cater to unfulfilled demand. The Unified Payment Interface, UPI, and Aadhaar are prime examples of such an infrastructure. The Indian healthcare sector has already embarked on a similar digitization journey with some tiny steps, of course. The pressing needs exposed by the current crisis, supported by private sector initiatives and new health policies, will jointly accelerate India's realization of a digital health care system. We embarked on this journey with the National Digital Health Mission by Honorable Prime Minister on 15th of August this year. It will be an inflection point in Indian healthcare. It will bring about much needed efficiency, transparency, accountability, and democratization of critical interactions among all vital stakeholders, patients, providers, and payers. The governance and economic impact resulting from this new architecture will not just increase the market size manifolds, but bring to focus outcome-based incentives. I have always believed that the healthcare delivery transformation in India can be achieved through the creation of an open digital health ecosystem. Such an ecosystem will be a set of open and secure digital health platforms that will be leveraged by all entities, public or private, to unlock transformative health delivery solutions. This ecosystem will fundamentally change the way in which healthcare is delivered today and unlock significant incremental economic opportunities for all the stakeholders in the healthcare ecosystem. Additionally, it will accelerate India's journey towards universal health coverage by creating a healthcare system that puts the patient at the center of all solutions and incorporates healthcare access and affordability to all. It will create a national digital health ecosystem that supports universal health coverage in an efficient, accessible, inclusive, affordable, timely, and safe manner. The implementation of NDHM, as we call it, is expected to significantly improve the efficiency and transparency of health services overall. Patients will be able to securely store and access their medical records, such as prescriptions, diagnostic reports, and discharge summaries, and share them with healthcare providers to ensure appropriate treatment and follow-up. NDHM will empower individuals with accurate information to enable informed decision-making and increase accountability of healthcare providers and help policymakers in evidence-based policymaking. The mission shall empower all stakeholders to make better decisions. Not only will it bring transparency and thus protect rights of patients, but also weed out inefficiencies from the system due to loss of medical records or information disparity. For insurers, it will actually help reduce frauds and thus make insurance premiums more sustainable, while also empowering them with structured data to design better and innovative products. The robust public digital infrastructure implemented by NDHM shall help bridge the gaps in healthcare ecosystem and lay out the imperatives of the healthcare industry, leveraging digital technologies. Be it Health ID, ensuring digital health identity for every individual, a health locker, and digital personal health record, keeping complete longitudinal health track for all individuals, defined unique registries for doctors, health workforce, and health facilities, or advanced initiatives like telemedicine and e-pharmacy. NDHM shall pave the way to ideal, democratized, technology-empowered, world-class healthcare ecosystem in the country. Most importantly, NDHM is built on the concept of openness and standardization and will standardize all health data to avoid fragmentation, ensure interoperability, and data compatibility across all health programs, schemes, and sectors. We have already rolled out NDHM in 6 union territories and are seeing some very exciting first set of outcomes. I'm sure that with the learning and such fast implementation, we will soon be rolling out the mission in the whole country. I will conclude by leaving a thought for all of you. That isn't this the ideal time for us to bring about the change in healthcare ecosystem? And isn't it the fact that the only way it will happen is utilizing the power of technology? The advent of technologies is the way to lead towards a paradigm shift in healthcare. Technology drives new demand pools, better, and empowers stakeholders for improved effectiveness. Indian healthcare needs to use technology to drive healthcare outcomes, and it has the potential to deliver quality health at scale and to radically impact health outcomes in the country. Today, We are at the cusp of breaking and jumping several barriers that are present in the current health. Digital technology shall be the key enabler in this aspect. It will create an integrated health system that puts the patient at the center of all solutions to deliver accessible, comprehensive, high quality, and affordable care. This will lead to an unprecedented change in products and delivery models. Healthcare players will or perish depending on how quickly they adapt to the new environment. Overall, this could lead to India leapfrogging its healthcare evolution curve. We are moving to a new normal. I'm sure that technology will be the strength helping us move forward. Thank you. Thank you very much for your time and attention. And thank you for inviting me to this session.
Thank you, Dr. Bhushan. That was a very enlightening address. You elaborated on the two flagship health programs, what each one is set out to achieve. You highlighted the extensive use of IT and how each program has focused on harnessing the data and subsequently use analytics to overcome the inherent challenges and bridge the gaps in the current health ecosystem. The various initiatives undertaken both under PMJ and NDHM aim to put the patient at the epicenter, aim to bring down the cost of health insurance to expand health coverage, and also to incentivize the ecosystem to deliver quality health care. We wish you and NHA more power in your attempt to build the national digital health ecosystem, deep participation from ecosystem players, because it is the concerted efforts which will help us leapfrog and finally realize the dream of affordable and quality health care for 1.3 billion Indians. Thank you.
Good evening. Welcome to the Bengaluru Tech Summit Digital Health Panel. And at this summit, we've had guests from diverse backgrounds speaking about how to unlock the potential of digital health in India. The opportunities with technology and data, challenges and enablers. Among the key enablers is the entrepreneurial energy of our country and the risk capital to back those entrepreneurs. So today, we will get the perspective of Dr. Vaibhav Agarwal, partner at Lightspeed Venture Partners. Lightspeed is a global venture capital firm focused on early stage investments in the consumer and enterprise space. I am Priya Karnik, a volunteer at iSpirit, and I'll be facilitating this discussion. iSpirit is a think and do tank, and we are comprised mostly of volunteers who devote their time to India's digital progress. You can read about our digital public goods and policy initiatives on our blog, pn.ispirit.in. Hi, Vaibhav. Welcome to the Bengaluru Tech Summit. It's great to have you here. Looking forward to a conversation.
Thank you, Priya. Thanks so much for inviting me. I'm delighted to be in conversation with you. Don't get to speak often on this subject, which is close to my heart. So really looking forward to a conversation with you.
Great. I introduced you as a partner at a venture firm. You've also been a physician and healthcare entrepreneur before becoming an investor. Do share with us your personal journey so the audience can know you better.
Yeah, sure. Look, I was always drawn towards healthcare from a young age. Nobody in my family is a doc. My parents are chartered accountants. They're in a financial services firm of their own. There's something about the ability to fix people's bodies, and the connection you build with them and the impact you have doing that, that drew me towards healthcare. And so, yeah, if you're in grade 10 and you were drawn towards healthcare, you go become a doctor. So that's what I did. I went to college in Bombay, and actually the first, the first renaissance in my life happened when I chanced upon the opportunity to spend a couple of summers in the US while I was still doing my MBBS. And at that time, it was explosive because here I was at a public hospital where we were always short on beds and doctors and medicines. And here, suddenly over the summer, I was in a system where we had so much technology and so much time. I think in retrospect, that sowed the seeds of me, wishing to make a change and trying to find ways to make that change. And so I think my my journey since that has been a story of trying to do that through different ways that has now culminated in being a venture capitalist. So after my MBBS, I went to the US and started training in emergency medicine in Chicago. And somewhere in my first year, I realized that my calling was not to train in a narrower and narrower specialty, but to actually move back and bring about big change. And so I moved back and started my first business, which was Prima Clinics, a chain of clinics. I used to unfashionably call it the McDonald's of healthcare. Quite an irony, but really standardized care for middle income Indians, and we did this in Delhi NCR. We built many sort of greenfield clinics. And I learned all my lessons in entrepreneurship doing that. This was still in 2009, 10, 11 timeframe, so pre-smartphone. It was pretty low tech, no tech from a customer's perspective. Exited that business, and then sort of moved around in a bunch of other roles. I worked with an investment fund called Espada, where I saw businesses outside healthcare. I launched another company in the Bay Area called Comfort, which was building a host of services for consumers like Urban Clap. Worked at an insurtech startup called Stride in the Valley that was bringing health insurance to people who didn't have coverage, and also briefly worked at McKinsey in the Valley, again serving a large insurer, a health insurer actually, on their health strategy. And now I've been back at Lightspeed for about 4 years, and I thought this would be a short stint, and I'd start another company, but I haven't left yet. and I think really enjoying the opportunity to meet entrepreneurs and invest across areas. So I'll tell you more about what we've done in healthcare as we chat more.
Great. I mean, fascinating journey and the number of changes that you've looked for in your stints. And I really love the phrase McDonald's of healthcare, because standardized healthcare is something that we look for. So healthcare, a phrase that I've often heard is healthcare is different. I hear references to regulations, an industry structure that is vertically specialized and loosely coupled, information asymmetry, a huge information asymmetry between healthcare providers and patients. So as an investor, what do you think about the healthcare landscape in India?
Yeah, Priya, I think that's a very fair comment. I think in general, I would say that my view is that healthcare is a large industry that's waiting to be disrupted with internet and technology, and inventive and creative entrepreneurs would build businesses and would dream up business models that would challenge all these conventions that you spoke about. I think those are real challenges, but great businesses get built solving those. Having said that, if I look around today, adoption of technology in healthcare is still very early. Outside billing systems, there's not much that hospitals use in terms of technology. If I look at insurance companies, again, there's very limited use of technology inside the guts of the business. Most of provider settings, which is small clinics and outpatient facilities, actually don't use any technology. And consumers are a bit confused, about where to go and who to trust. So I think net it feels like it's still very early days. However, I feel there are some very, very powerful winds of change, and now pieces coming together that would enable business creation. To name a few, I think number one is just internet penetration and smartphones that everybody has. I think does build a pipe that enables anyone to reach any number of consumers today. I think that's true for internet in general, but that's also true for healthcare. I think second is a bunch of infrastructure that is now becoming available. For example, through the National Health Stack that you're closely involved with. I think key pieces of infrastructure, whether it's patient registries, doctor registries, I think will play a very crucial role in ushering in a healthcare adoption. And then I think finally, I would say that with COVID, very very powerful change in how doctors and pharma companies do their business. Right, no longer are MRs able to go into doctor's clinic and spend as much time as they used to. Doctors are getting pinged by patients on WhatsApp. So I think just the openness to adopt technology by providers and pharma is just very different. So I think that a combination of all these, I think, will prove to be powerful winds of change.
So, if you were advising a healthcare, entrepreneur in a healthcare space as a venture, from someone from the venture world, what are some of the aspects would you, get the entrepreneur to focus on? Because doctor is a key decision maker in the healthcare space. So, what dimensions of those business should the entrepreneur look at when starting?
Yeah, I think it's a great question, Priya, and I think you hit the nail on the head when you said the doctor is a key decision maker. I think in general, my observation is that in healthcare, not many teams have come together where people who understand healthcare and people who understand internet and technology have worked together in unison.
The
Um,
collaboration aspect of it, yes.
yeah. Either I've seen sort of people inside healthcare trying to build businesses, but they really don't know how to build for scale, or there are people, who understand internet and consumer, trying to build for healthcare, but realize that the models that they've learned actually don't really apply. I think true power can get unleashed when these two sides learn to talk with each other and build together. I think that's very powerful. Um, I think the second thing is it's really important to understand where points of decision making in healthcare lie. And you're right, a lot of the spend is driven by doctors. When I was running my clinic chain, we realized that consultations is a little bit like payments in the healthcare space. It's a loss leader. It doesn't make any money, but it's a gateway to all the profit pools, which is either diagnostics or pharma or inpatient hospital spend. Um, so really, understanding, what that point of demand creation, which is the doctor's, prescription, how that behaves, how that runs, what are the doctor's incentives, and what is the number one reason for the doctor to adopt your product or service, I think is really important. I find a lot of startups that start off with very good intentions, making positive clinical impact and having a lot of do good mission, but just don't get adoption because they don't solve the business needs of the doctor. I think saving time and increasing revenue are the top two needs that any doctor has, and I think a startup has to really hit home on those.
And I assume, it's also important that any solution that, come up with works 10x better for the doctor than the existing solutions. I think that difference is also key, is my view.
You're very right. When I was in the US and we would be using an EMR like Epic, it would take me like a 7-week training, and then when I would be in a patient encounter, I would be literally sitting in front of the desktop, typing away notes, and then only looking sideways to see the patient once in a while. It was really awkward and inhumane interaction. I think in India, doctors have a very fair reason to not adopt any technology. For example, one of my friends said, "Well, I can write a paper prescription in 10 minutes, and if I adopt an EMR, it takes me 20. Why should I?" And it's a very fair question, and those are the kinds of things that technology has to solve. It has to be much, much, much better and faster than offline, as you said, to get true adoption.
Yeah, so while we spoke about key decision makers, making the user experience 10x better for them, understanding their business drivers and working towards what solutions will work for them. Now, in a low trust and it's the commercial viability, and in a country like India, you have to plan for scale. India is also a low trust society, and then when it comes to healthcare, the trust aspect of trust also becomes very important. So, in going forward, building products in the healthcare segment, how do you look at trust and how do you develop products that bring forward this trust?
I, that's a, I think that's a great comment. And add another one, which is frequency, right? So healthcare by nature, or at least teleconsults, if we sort of just focus on that for a second, for the general population at large, is a low frequency interaction. And so a combination of I need to see a lot to build trust, and by the way, it's a low frequency interaction, and by the way, it's also a low ticket transaction. Compare it to, you know, a transaction on Amazon or Flipkart, you know, where average transaction might be, let's say, 1,000 rupees or what have you. Average consultation in this country is probably like still 100 rupees, right? And you put, you know, some prescriptions and diagnostics on top, maybe it's 200, 250 rupees, but still, you know, that. And when you see who the power users of internet are, it's mostly young population. Well, they're not going to fall sick a whole lot, right? So I think it's that creates a, you know, an example of, you know, what you know, the perfect storm that actually creates a lot of challenges for startups to scale. But having said that, I think founders who are switched on to these challenges and who are thinking about you know, working around these things in a hacky way, I think navigate to interesting solutions. So as an example, you know, if founders have landed on the core insight that, you know, patients will always find it hard to build enough trust to find a new doctor online, can I actually connect patients to their current doctors, right? Instead of powering discovery, can I power convenience and workflow between patient and doctors? And, you know, I've seen examples of companies that actually find a lot more adoption doing that versus trying to power discovery. Another interesting, you know, insight comes from our learnings in education, for example, which also tends to be a category where trust is low. People don't really you know, want to experiment with new teachers, or don't really want to experiment with you know, a school year, you know, in the same way that they might experiment for buying a product from an e-commerce website. So, you know, education has done well in really you know, in partnering with trusted brands, you know, whether it's universities, whether it's certifications, whether it's large organizations that really bring trust to any interaction that a patient has for the first time. So I think those are all real problems, and there are you know, different solutions out there, but somebody has to really stitch them together into a business.
Yeah, in that context, I think the initiatives by the National Digital Health Mission with the Health ID and the doctor registry that you mentioned, and even for the facilities or the healthcare provider, it goes a long way in bringing that level of trust to a degree where market can innovate. Excellent insights, Vaibhav. So, given this context, given this environment, what opportunities do you see for an entrepreneur? Something, you know, more specific in terms of either around patients, around doctors. Would love to hear your thoughts on that.
Yeah, no, happy to chime in. You know, I maybe talk about 2 or 3 that I'm excited about. I think one is tools for doctors. You know, I think there's been a lot of attempts at building for consumers, but I think the real opportunity in healthcare lies in building tools for doctors. And it could be a variety of things, whether it's, you know, helping them improve their practice, whether it's helping them track their patients, whether it's them, you know, building some sort of CRM, you know, customer relationship management tools that allow them to, you know, run marketing campaigns for their patients or what have you. I think there's real opportunity in creating tools for doctors and making their lives better and making their businesses better. I'm already starting to see you know, products that, for example, make it easier for hospitals to keep track of patients and prevent pharmacy prescription leakage, and make it easier for them to follow up, etc. You know, I'll share one interesting insight with you. We recently ran a survey where we you know, spoke to doctors in several cities in the country and asked them how COVID is impacting their practices. And what we've discovered is that about 20 to 25% of all doctors' practice, so I'm referring to consults, is likely to stay digital post-COVID, and this number was close to 0 like 9 months ago. So I think it went from 0 to 100% when the country locked down, but it might still settle at 20-25%. There's something we've seen in China. There's something we've seen in Europe. So I think there's a real opportunity. And today doctors really don't have any tools. I mean, I have several friends who just basically get WhatsApp images from unknown numbers asking what should I do, and doctors really no position to make any professionally sound decisions. So I think real opportunity there. I think second is opportunity to create products for pharma companies. I think the way pharma companies used to do their business, which was run field forces of pharma sales reps going to doctors and detailing products, I think is going to change. In our conversations with several pharma leaders, we hear how productivity has fallen, and companies are realizing that they need to adopt digital tools to engage doctors, to detail doctors. And that's a huge opportunity. In the country today, about $4 to $5 billion is spent on just pharma sales and marketing, and even if 20% of that moves online over the next few years, that's a $1 billion plus market. I think that's a super interesting opportunity. I would say there's also an opportunity to innovate on insurance. That opportunity, I think, is more medium term. Really today, if you talk to any consumer or any employer, who are buyers of health insurance, their net promoter scores with their current providers are super low. Most products are undifferentiated. It's a race to the bottom, and there's a real opportunity to create products that delight consumers. Much in the same way that our payment companies and banks were undifferentiated 5 years ago in this country, and look where we've come all the way. From Paytm to PhonePe to now, all sorts of delightful products like Zerodha, Cred, OK Credit, and so on. I think there's a real opportunity, and in the next 5 to 7 years, you're going to start seeing specialized, delightful health risk products, that are available in the market. And I think in that context, the work that NHS is doing now, with respect to laying down the rails by means of e-claims and claims engines and the switch, I think would be pivotal in enabling that. And then I think last but not the least, Priya, I think there's a real opportunity for entrepreneurs to build from India for the US. We invested in a company called Innovaser, which is selling software from India to large hospitals and insurers and pharma companies. And we've just seen how deep that market is. We've just seen how quickly these companies scale. Now Innovaser in the US is a leader in its category and regularly takes down $1, $2, $3, $5 million accounts, annual recurring. So I think there's a real opportunity, and India is actually a place where there's competitive advantage to develop products because data is easily available. Regulations are not strict enough to prevent innovation, and there's good talent available. If you want to build AI for radiology, there's radiologists available and plenty of data available. If you want to build a digital therapeutic, we have a high patient population base that's powered, that's connected through smartphones. So that sort of creates a rich bed to innovate in a responsible way. I think there's a lot of opportunity in healthcare from my perspective.
Yeah, that's wonderful to hear, and it's nice to hear you talking about doctors and the opportunity for India building for the world, and within India, better tools for the doctors and the insurance, of course. India is underpenetrated with respect to insurance and lots of opportunities there. Great. We intuitively, it's understood that technology and data is going to transform digital healthcare landscape. Digital health is also seen as a remedy for affordability and accessibility, while simultaneously improving health outcomes and enhancing the quality of health. So what do we need to be cautious about? And so we can proactively work on these challenges that you foresee.
Yeah. Maybe Priya, I think maybe I'll cut it into two segments. One is sort of just for ecosystem at large, and then second, specifically for teams going after this, this category. I think on ecosystem at large, I would say, there's still a whole lot of maturity that needs to come in terms of buying software. In the way hospitals, or pharma companies today approach software, reminds me of how large businesses would buy software in this country maybe 20 years ago. Every hospital sort of thinking about, oh, should I build this or buy this? Why do I need this? If I need this, can this be on-prem? I mean, da 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 da. I think there's a whole lot of catching up that our enterprises in healthcare need to do to really usher in innovation and technology. I think the other is I think specifically for teams, I would say that we have to build great teams to solve and build products and problems in and businesses in healthcare. As I alluded to before, I think internet technologists and healthcare experts have to really come together and co-create, and that is important, because otherwise solutions really don't lend themselves well to the problem statement. And then I would say finally, the market structure in healthcare is hard, is different, right? So India is very different from, let's say, the US. And so I think we need bottoms up first principles innovation for India, for successful businesses to get born. I'll take an example. It's sometimes seductive to think, oh, Livongo works in the US, it's a highly priced company, and now India is a diabetic capital of the world, sadly, but large addressable population base. Oh, can I take the Livongo model and apply it for India? Well, guess what? It doesn't work, because Livongo is was built on the back of self-insured employers in the US, which just don't exist in India. And so try selling a chronic health therapeutic to the patient, and you realize that they don't make their own decisions. So now I need to go to the doctor. So simply just the whole dynamic of the business and what needs to get sold and what's the value proposition completely changes. And I think that's the reality, category after category after category. Another good example is, if you think about e-pharma and e-commerce for drugs, it was really born in India way before it was born in China or the US. So I actually think a lot of models that will work for India will get copied elsewhere versus the other way around.
Yeah, I mean, it's interesting how we say that Spirit's philosophy is also we need to create our own templates and not rely on any Western templates, because India's problem is unique, and we are better off coming off with grounds up innovation from India. I'm glad to hear that. The potential of AI is often spoken about, and for that, data and how people have access to data it has to be thought through and designed for. What is your view on data, digital data, and the creation and how it exists in the country?
I think, Priya, it's very early for AI. While the power of technology to produce clinical outcome is well beyond proven. We've seen data where AI is as good as humans, or sometimes even better, to read radiology scans, to read dermatology scans, to read patient histopathology slides, and so on. So there's no doubt that the technology potential exists, right? But leaving that aside, I think there are key barriers to why I think AI in healthcare is a little distance away from full scale adoption. Number one is access to data. In several categories, data is just not available. So for example, while you might have lots of chest x-rays and CT scans available, if you're trying to build AI for let's say retinal imaging, right? Guess what? Most ophthalmologists actually don't have digital retinal scans available readily that you can train your models on. Or if you want to build, AI for histopathology, guess what? Most microscopes used in the country are still analog microscopes. You don't have data. So that's one. Second is AI. Uh, AI is most powerful when it is embedded inside existing physician workflows. So, for example, if a radiologist is used to seeing scans on a certain DICOM viewer, and you have an AI product running in the background, and it is able to prompt the doctor that, hey, here's a finding that you might be missing, or hey, we think there's a 90% chance that this scan is a case of X, right? What do you think? AI, that to me works beautifully when it is already inside the workflow of a doctor. But going back to the conversation, 95% plus of today doctor-patient interactions are not happening in a digital medium, and so without a core workflow which is data and technology led, I wonder, what is the natural point of application of AI? It's like, if you don't have the systems of record and systems of engagement, systems of intelligence, which is AI, actually doesn't have something to sit on. So I think that's the other core challenge that I see today.
So, so you're speaking about AI and focus on, and in summary, focus on areas where digital data exists, where you can embed the enhancement or the augmentation in the workflow for the doctor. And these two have to be thought through and taken into consideration before you look at AI opportunities. Another important aspect here is the ability to exchange or transfer personal health data for purposes of could be better diagnosis, second opinion, and that is where I see the real-time consent-based sharing of health information could act as a facilitator for the startups who want to get access to data if there are enough patients to consent, and provided that's embedded in the workflow, because patients may be amenable to sharing data with the doctors, as you mentioned. We've seen some aspects of it play out in the financial world as well with the account aggregator, and we are seeing similar initiative taken with respect to personal health data on the back of the data privacy policies. So, great, insightful conversation, Vaibhav. I will spend some time now looking at the questions. Maybe, so I'm going to put the questions into themes and maybe paraphrase for you. You spoke about doctor adoption, right? And what opportunities do you see in very patient-centric solutions? Because healthcare experience for consumers is equally broken. That's one question. You want to take that?
Sure. I actually think chronics in this country actually have access to very poor tools to manage themselves. And I think there's a real opportunity to create delightful products for them that make it, just easier, more convenient, less anxiety driving experience for them to access healthcare and know just how they're doing. I think that's a huge opportunity, and I think the right solutions will bring in self-care, physician and physician intervention, and drug and pharma and diagnostics in a very, very holistic way. I think that could be a powerful product. It just has to be done. I think two things will have to work for it to really scale up. One is it has to be priced low enough that it can really drive, it can really find massive adoption. And second, it has to make business case for doctors so that they are actively advocating for this product among their patients.
That's Great. And chronic care also speaks to about your point on the frequency of use cases and the engagement that patient-centric solutions can drive and really create an engagement with the hospital or the healthcare provider and the patient, which is more frequent and it requires to be managed better than one-off consultations.
Yeah, I mean, it's interesting. If you talk to a doctor, right, about a chronic, he basically will tell you without saying this in as many words that the LTV to CAC on a chronic patient is the most attractive for them. So actually, it actually even makes sense for them to manage these patients and provide them superior customer service and to almost account manage them and retain them in a delightful way. But today they just don't have tools to do that. So I think it's the two sides of the same coin. On the one hand, patients get access to doctors and all the services, and then on the other, doctors get to manage this high value population base better.
The other question that I have is, we spoke a lot about doctor adoption, and what is the nature of doctor adoption that works for in the healthcare industry from your perspective? Do the top doctors have to adopt it? What percentage of community have to adopt it? Is it where you see a lot of challenges in doctor adoption, which is different from other sectors that you deal with?
Yeah, absolutely. I think Priya, you're an insider, to be asking this question. I think it's a really insightful question. I think in healthcare, adoption starts from the top. And this is something I've learned painfully. It really matters to doctors, to know who else is using the product. It's interesting, and sometimes the way I describe it in private is, doctors weren't trained to try products and fail fast. All their training actually in medicine is all about evidence-based, best practice. A thing has to be proven 10 times over, gold standard healthcare, treatment protocol. And so actually doctors are trained to be risk averse. They're trained to not take risks when they're dealing with patients' lives. And they bring the same attitude to new technology. They will not adopt something unless they have high belief that it is sufficiently proven. And therefore, I think in healthcare, it becomes even more important to get adoption of the top doctors first, because then the other doctors who look at them as influencers build sufficient trust and confidence in adopting your product. Again, a nuance but a very powerful one, and drives go to market in healthcare that from the outset doesn't seem very obvious.
That's a great insight, and thanks for sharing that, given your background as both a physician and an investor. I think thanks, Vaibhav, for the insightful conversation, and I really enjoyed having this dialogue with you. And in summary, I think we covered kind of what the healthcare landscape in India looks like for an entrepreneur. It's important to look at doctor adoption or key decision maker adoption. How do you make 10x better from a user experience perspective for that adoption to happen? Look at commercial viability, scale, really the point that you made right now about how do the various community adopt solution. The data, if you're looking at AI opportunity, the data and where data sets exist for AI to work, how do you embed the data augmentation solutions in the workflow for the doctor to adopt? And this is and the opportunities you spoke about, enterprise opportunities in enterprise insurance, making something for the world. Again, very insightful conversation on diverse topics, and thanks for being here. Thank you. Good afternoon. Welcome to the Bengaluru Tech Summit Digital Health Stream. Digital health is vital for the health delivery system. It has the potential to provide affordable healthcare to all bridge supply and infrastructure gaps while simultaneously enhancing both provider and patient experience. Digital health is also expected to enhance the quality of care by providing impetus to good actors in the ecosystem and enabling better measurement and monitoring of health outcomes. Given this realm of possibilities, what are the ways to unlock of digital health? What are the challenges for adoption? Also, with its entrepreneurial energy in India and coupled with public digital infrastructure like the National Digital Health Mission, can Indian health delivery system become a model for the rest of the world? Today, we have a diverse panel of experts to discuss the way to unlock the potential of digital health. I am Priya Karnik, a volunteer at iSpirit. iSpirit is a think and do tank comprised mostly of volunteers who want to devote their time towards working towards India's digital progress. You can find and details and read up about our digital public policy and public good initiatives on our blog, pn.ispirit.in. We have Dr. Ajay Nair. Dr. Ajay Nair is the CEO of Swasth, a non-profit alliance that builds digital health infrastructure for public benefit. He joined Swasth after extensive experience in the health sector across telemedicine, public health, health tech entrepreneurship, healthcare policy, and social impact investing. In 2010, he co-founded and led Mera Doctor to become one of India's largest telemedicine networks. Welcome, Ajay, to the panel. Looking forward to the interaction.
Thank you, Priya.
Shashank. Shashank is the founder and CEO of Practo, the country's leading integrated healthcare company. Shashank founded Practo to make healthcare more connected, integrated, and efficient. Under his leadership, Practo has grown to serve about 30 crore or 300 million patients, 100,000 plus doctor partners, and healthcare providers across 20 countries. Welcome, Shashank.
Thanks, Priya.
We have Viren. Viren Shetty is the Chief Operating Officer of China Health, a world-renowned healthcare group, where he is currently driving the digital transformation for the group. His past experience includes strategy, hospital design, construction and operations, project planning, supply chain management, and business development and healthcare policy. Welcome, Viren. Great to have you on the panel.
Thanks, Priya. I'm glad to be here.
We have Dr. Michelle Perugini, co-founder and CEO of Precigen, an AI healthcare company focused on building scalable AI products for women's health. In addition to being a serial entrepreneur, Dr. Perugini has spent time in academia and is an internationally renowned expert in health, medical research, advanced analytics, and AI. Welcome to the panel, Michelle. Great to have you here.
Thanks so much, Priya. Great to be here.
Great. Viren, let's start with you. Hospitals as care providers are instrumental for care coordination and providing the infrastructure, bringing the caregivers and patients together. They are also a base for clinical research. In this context, what do you see as the potential of digital health?
I like the comment you made earlier, which is hospitals as the central care coordinators. While we like to see ourselves that way, the honest truth is that we do a terrible job of coordinating health. In our Health City campus in Bangalore, we have two separate buildings, one a dedicated cardiac building, the other a multi-specialty and cancer building. It is not even possible to coordinate a single department between those two buildings in one campus. Forget about coordinating the care between patients that are millions of miles away. So I would say the biggest role and the impact that digitization will bring in is being able to create virtual care coordination of the kind that the Swasth Alliance and companies like Practo are working on. Because ultimately, hospitals are bound in space. We have a definite location. and all things flow through a central location. But that's not how the modern world works anymore. In these COVID times, with all of us working remotely, patient care will also be managed remotely. And that we see as one of the primary opportunities for hospitals to embrace digitization as a way to coordinate care with patients without patients having to physically visit a hospital.
Great. And Shashank, the point that you made about, Viren, about virtual care coordination, I'm sure it's important in the context, even more important in the context of chronic diseases. And thanks for your inputs. Shashank, as the founder of a leading digital-first healthcare company, where do you think we are in the journey of digital health? And what further potential or opportunities you see?
Thanks. I think in terms of digital health, in healthcare is largely in India, at least, so trying to solve on three main axes. The first one is being able to provide healthcare for all, that's access. The second one is to making sure it's affordable to everyone, and the third one is to make sure the quality is at the highest order. I think on digital health, we've thanks to the growth in telemedicine, e-pharmacy, and many of the other virtual goods in healthcare, we've been able to provide access to at least a doctor to all parts of India, at least those that actually have access to internet. And with the spread of internet, I think access will get solved to a larger degree. Again, thanks to telemedicine, even the access to affordable primary care is getting better. If you combine the costs of travel and time and etc., the telemedicine is probably at around 20 to 30% of the cost of a physical consultation. So there are progress that's being made in affordability. But I think where we are still at the in very initial stages is how can digital help in solving for quality, and that's where I think there's a huge opportunity. And to the point that Viren was sharing, the fact that coordinated care can take place would allow quality to be solved for. In the case of digital, the ability for digital to solve for quackery, where every doctor who's actually online is one that has the relevant degrees and the right accreditations to practice the form of healthcare that he or she is doing, to make sure that genuine medicines are the only ones that are shipped digitally to all the various parts of India, will ensure that quality can move up. The fact that digital healthcare is available 24/7 on just a tip of your fingers means that hopefully consumers will access it in the initial stages of their health episodes, which will again lead to more preventive nature of curing for diseases. The ability for doctors to keep in touch with their patients post their surgery or post their consultation, and much longer periods would mean that during chronic conditions or lifestyle diseases, there's continuous care being provided. The ability for use of data and since many of the teleconsultations are happening online through video or text formats, one can do a much better job of data audits and ensuring the quality audits are taking place. And this data, which is coming together, can also lead to much better treatment pathways that can be put together, because you're learning from the data at a constant speed. So given all of this, there's a lot of potential on the quality side, and we're hopeful that, which is a very, very important part of healthcare, that digital can contribute to the quality and outcomes of patients as well going forward. So I think in that aspect, we're still at very much the tip of the iceberg, and there's a lot to do in the coming many years.
Hey, thanks, Shashank. I think you covered affordability, accessibility, and quality, and the pre and the post, care aspects. Michelle, Shashank mentioned, and we all intuitively understand the potential of AI in digital health. I think with Precigen, you're the one translating that potential into a reality. So it'll be great to hear about impact stories and your vision for AI in digital health.
Yeah, absolutely. I really echo the sentiments of Viren and Shashank around kind of the ability for digital health to really increase accessibility of healthcare. It's particularly important in markets like India, but it's important globally, really. And I come at this from a global perspective. So we work as a company, my company is called Precigen. We work in the healthcare sector, delivering or building scalable AI products that can be delivered globally. Now, when you think about artificial intelligence, in order to bring a global product that's scalable, it actually needs to be built on globally diverse data sets, because otherwise it can't translate or work in different clinical environments and different patient demographics. And that's actually an incredibly difficult thing to do in the healthcare context, because data is locked up in all distributed clinical environments all around the world, and it's very difficult to access that data, particularly with data privacy laws. So that's one issue, is around data access and data quality, to the extent that you can actually build these products that can then be used effectively in the clinical environment. So we've kind of created approaches using federated AI training, and we've taken a global approach to data collection so that we can build products that are based on globally diverse data that actually can be used in different clinical environments. Now, one of the examples of that is our Life Whisperer product, where we use AI for embryo selection or embryo assessment during the IVF process. That product is available in India now, and it's really amazing that we could build this technology on a global data set and then use it in clinics in India where we've never even trained on data from those clinics, and it works equally well. So I guess one of the big challenges with digital health and technologies like artificial intelligence is you need access to large amounts of data. It needs to be good quality. It needs to be globally and clinically representative. And only if you build it at scale can you deliver it at an affordable price for the population. And so you really can't avoid the scalability issues when it comes to digital health. It needs to be scalable so that it's affordable for the consumer, the end consumer, or the hospital system that needs to be able to utilise it. But there's a huge amount of benefits that digital health is enabling, bringing global technologies into different markets. But I think there's also a massive opportunity within the Indian context. I know, Priya, we spoke earlier about, the desire to be better at collecting globally connected, or at least India connected data, so that you can leverage that data into different digital health solutions. So huge opportunity.
Hey, thanks, Michelle, and I, agree with your view on making data accessible for any AI solutions. I think in India, it's great that we are seeing proactively the National Digital Health Mission working on both creating a voluntary health ID to tag all the health records, and a real-time consent-based sharing of health records. So there's based on the patient consent, you have the potential to aggregate these data sets. Great to hear your thoughts. Moving on to Ajay, we are clearly seeing a lot of opportunities and innovation in digital health, the desire to do more. In this context and in this evolving context, what do you see as a role for a non-profit alliance like Swasth?
Thank you. Priya, so I think, again, echo everything that the other panelists have said so far. But when we think about, and India is an interesting place, right? So on one end, you have really world-beating care quality, like Narayana, for example, does incredible high-quality work that is, hands down, amongst the best in the world. But we are also a country of 1.3 billion people, where our organized health sector and our organized technology sector serves about the top 150 to 200 million people, while the rest are mostly served by a very poor system of mostly unorganized providers. And to me, there is, there's very few examples of other places in the world that have been able to create systems of care for these many people. So I almost feel like India has to invent its own. And it can only happen with coordination amongst the private sector, amongst the government, between the organized and unorganized sectors. There's also the fact that we don't have enough health workers, and we are unlikely to have formally trained health workers in every village in the next 10, 15 years, right? So to me, there's a huge need to leverage technology, a huge need to really bring these actors together because as we've learned during this pandemic that we can't exist in this bubble up top and let the rest of the country do what it's doing or get the care that it's getting today. So to me, one of the goals of SWAST is to bring a lot of these actors together, use technology as the common uniting thread, and figure out how we can create solutions that can be deployed at the bottom of the pyramid, right? So can we take the best of what is there in India, which is really world-class, and can we really help scale that in whatever way possible, right? And again, technology, I think there are a few pieces. One is the idea of care coordination and quality that panelists have spoken about before. But there's also the question of access. Can technology really can we have an ASHA worker or a frontline community health worker be able to take the best tools that Michelle is building, the best advice that Narayana Health has, down to the community, down into the community and into the village and directly to a patient? Is that possible, right? So to me, there is a huge role for tech to actually enable access. And that is one of the things that we hope to help enable as a nonprofit collective that's really looking at trying to solve for the last mile.
Okay, that's great to hear on the, on an organization focused on as an alliance solving for the last mile. We've heard the potential for digital health from all the panelists, and I want to spend some time on the challenges. We all understand the potential, but what are the challenges, or you could speak about key enablers for realizing the potential? Michelle, you want to give your thoughts?
Yeah, I think, we touched on it earlier, but data is definitely a key enabler, and it's really critical to pretty much underpin any level of connectedness, any level of technology development is going to require, good quality data. So it's really great that the personalised health records type approach is something that's worked well in other countries and will also serve India well at being able to connect and collect that data that underpins the technology solutions. Having said that, it is a great challenge in a country with such a huge population to be able to connect and build its own capability. So it's kind of, I think it's always a balance between technology usage and consumption versus technology development, and how do you build that sovereign capability of technology that you can then deliver to improve your own healthcare system. And that's a great challenge that many different countries have faced. But yeah, I think data is the core challenge. How do you access and leverage data? How do you leverage technologies that are being utilised elsewhere in the world to really create that access within India and bring better healthcare that can reach the whole population is a big challenge.
Hey, Michelle, that's great. And one of the questions that I have is on collaboration and how do you work with doctors, but I'll come back to you on that. Viren and Shashank, it'll be great to hear from you the challenges you see in adoption of digital health. Viren, you want to go first?
Yeah. It does carry tremendous promise. When we adopt digitization, you can make healthcare faster, safer, cheaper, and improve the quality, no doubt. But just applying it without any regard to a lot of the challenges that we face. So implementing something like AI. AI can, in theory, help doctors make better decisions. By the same logic, if I were to buy a Ferrari, I could get to the Bangalore airport faster. I could. I absolutely could. But someone else will need to solve for the traffic, for the quality of the roads, for the stoplights, for traffic signals, for driver discipline. And all of that needs to be put in. We have spent a tremendous amount of money building a hospital information system. And this is something built on the latest technology stack. It's something that we wanted to build not just for ourselves, but for hospitals across the developing world to take them to that next level. And we started a conversation with hospitals across India, but their challenges are extremely basic. When we were building it, we were solving for a software we had that wasn't great, and we're building a better iteration of that, the best iteration of that. The hospital we're speaking with are coming from a zone of no software. So theirs is a 0 to 1 challenge. The IT teams they have, the most amount of work they're able to do is so far just handling login passwords for Windows, or solving for if the internet connection is not able to connect. That is the level of digital literacy for a lot of hospitals. A lot of doctors aren't fully convinced that they need to spend that much money in digitizing their practice because what is there works quite fine. And so that's another significant hurdle that a lot of companies, as they're coming in with the promise of improving this practice, which is not immediate. The truth is that only hospitals that are already digitized will see immediate gains. But the hospitals that need it the most are still on paper with no accounting systems, no internet, and sometimes no electricity. And so for them, you're pitching a 10-year vision with an upfront cost right now. And the cost isn't just about money. The software solution we're building, we're not even planning to charge people for it. It is a cost for them because in order to run a cloud-based HIS, they need to first have an internet connection, which they don't have. They need to have Cat6 Ethernet wiring across the hospital, which they don't have. They need to have Wi-Fi everywhere, which they don't have. They need legible Windows licenses, which a lot of hospitals in India do not have. So it is a tremendous challenge, but it is a journey. The government has put the stake in the ground, indicated their seriousness of taking up digitization across India in a big way. They put in the standards. The NDHM is not a perfect solution. It is the start of something. And 10 or 20 years from now, all the digital entrepreneurs of the future will look back on this time and say, yes, this was what started all of it.
So Viren, you spoke about the challenges. In your view, what else needs to be done to enable this adoption among these long tail of providers?
So this is always a bit of the challenge. In the US, they implemented something called the HITECH Act, which literally paid health systems to adopt electronic medical records. It didn't improve the quality of the electronic medical records. It just was a handout from government to tech companies. Something like that should not happen in India, and it will not. We obviously have much higher priorities in this country. I would say there is a tremendous partner ecosystem. There are a lot of nonprofits, a lot of for-profit entrepreneurs, a lot of major companies looking at this in a big way. I would say that this will happen regardless. I don't think you need to do too much beyond the current regulatory steps that they are taking for a sort of large-scale push. Ultimately, you have to grow the overall healthcare sector. So solve for the basic challenges. Train more doctors, train more nurses, put in more paramedics and training centers, and find a good system that people can access healthcare. As overall healthcare market grows, and as people start to distinguish between what is a high quality healthcare provider and what isn't, then you start to realize that these are the steps that distinguish someone who provides good clinical care and those that don't. And generally you'll find that those that are more interested in outcomes management are the ones that tend to push towards digitization.
Thanks, Viren. I do, if time permits, I would love to know more about your views on the training of the caregivers and what role technology can play there. But I'll move to Shashank now. Shashank, what challenges do you see on the ground in adoption of digital?
I think there are, it's all about incentives. You need to, for long-term benefits, you need to, start also showing short-term incentives for providers, for patients to start adopting technology. So let's start on the, and these incentives have to be 10x, right? It has to be the 10x on quality or 10x on, some form of return to the providers or the consumers. I think the first thing that digital will start seeing is, you need to there have to be some wins in the digital space. And to see these wins, healthcare works on trust, and trust is the basic parameter on which healthcare works. And we need to ensure that the digital space also aspires to providing the highest quality of outcomes and highest quality in their work, and to which we have to start creating minimum standards. The internet offers a lot of innovative solutions and quick upstarts, and that's why startups come into this space, because it's fast to get started. But we have to also make sure there's some minimum quality that is maintained. Otherwise, the trust starts deteriorating. And we have seen that also happening in the alternate medicine space, where if certain quality standards are not met, you start seeing a lot more quackery taking place. So the right level of accreditation, if we can start having accreditation for online telemedicine players and online digital providers, it will lead to certain basic qualities being maintained and hence enhancing the trust of consumers on online platforms. It could be an offline provider going online, or it could be new online companies themselves. But having accreditation, I think, will solve it. We have NABH, which brings in certain quality standards for the offline providers, but I think we need something similar for the online space. Second is, to the point that Michelle was talking about on data. Now we might have all this data sitting in different, discrete locations and individual silos. But if they're not connected to each other, you really can't make much use of the data. So it's again important to create the right incentives for interoperability and standards. And I think the NDHM is a good start in putting those railroads in place, that there are standards that can ensure interoperability. But really, the question comes back to the question of incentives, and I think Viren put it really well. That why would a hospital or a doctor invest money into digitalizing the records when he can get somebody at the cost of 1/10 to write notes or to manage this without it. So the right incentives have to be in place. While HITECH Act in the US and meaningful usage of software came in, because in the US there were already very clear data showing the fact that if software is being used, how it could improve outcomes and how it could reduce fraud and how it could actually reduce the cost of healthcare overall, thanks to the data that came from the insurance companies. But we are way far behind from there. Our insurance penetration is awful and very minimal. So what we have seen is that in countries which have very high level of insurance penetration, that's where you start seeing incentives being passed on by the insurer. It could be a private insurer or a government payer. And they see cost benefits of actual digitalization at the last mile, making sure they can give that out in terms of doleouts to the provider. So we need to find a pathway to getting the country more insured. And both OPD insurance and IPD insurance and forms of preventive insurance, finding means of ways of getting more penetration of this would mean that consumers start spending more towards health in a more preventive manner, which again brings the right kind of incentives into the whole ecosystem to actually driving digitalization. So these are some of the ways in which I personally think digitalization can be enhanced, and the roadblocks that we see today of siloed data can be taken away, and the right incentives being provided for digitalization at the last mile.
Hey, thanks, Shashank. I think I'm highlighting 2 points that you made. One, it's for the provider of solutions that they make solution. I think Viren mentioned that 10x better. And makes business sense for, as both Viren and Shashank mentioned, business sense for the person who's adopting, because, and that has to be weaved in with any new product an entrepreneur is developing. The second point that you made about standards, ensuring that there is some standards for digital healthcare. I'm going to segue this, use this to segue to Ajay. Ajay, what role do you see for a non-profit alliance in the role of, in these policies or standards? It could be for your members. Would you share your thoughts?
Sure. So I think, building off of what others have spoken here before, India is a very different trajectory on digitization. I worked in Africa and in the US, and I remember being in the US when Meaningful Use was being rolled out. And I remember getting a check from the US government in my mail asking me to buy an iPad. Because they were literally sending checks to doctors, right? Like they were sending checks to doctors saying, go buy an iPad. And so usually digitization has happened with a carrot or a stick. And like Shashank said, usually it's a payer driving it. And in India, we don't really have either, right? We don't have a large payer that can drive it. And we don't have the carrot of a lot of financial reward at the end of the road. So it's a very different trajectory, but it's an interesting trajectory because I think each provider is making a value-based call on what technology is useful for them, right? It's not top down, it is really bottom up. And I think that's a very, very interesting position that we are in. So to me, alliance like Swasth is to actually, what we are trying to do is we're starting to engage a lot of these players, starting to have conversations with them around what is useful for them, right? What are their current roadblocks? What can technology solve for them? And then that's sort of one layer of this. And when it comes to the access piece, and on standards, etc., again, there are a few different elements to it, right? So one of the things that we're working on are semantic standards around information being passed. And that's another huge step India is taking, right? Which is that what we are saying as a nation is that this digitization will happen slowly, and as it happens, in these multiple silos, let's make sure that happens in a way that is interoperable from day zero. And what that interoperability does is that it then starts unlocking the potential of data, like Michelle's spoken about before, et cetera, right? So there's huge benefits there. And then on the other end, on access, we have a long history of tech trying to solve for healthcare access, right? It goes all the way back to ISRO trying to do telemedicine in the late 90s and the early 2000s. The work that I did 10 years ago around telemedicine in rural India, and a lot of others have done. But it's always been challenging because I think one should see health as a very complex adaptive system, and there's no there's no thin technology layer that will really solve for it, right? So one has to figure out how to really use technology in the context of the ecosystem that exists today. And it's a very wide ecosystem with a small number of organized players and over 1 million unorganized players who are doing over 1 billion transactions a year, right? So I think, to me, in true, slightly chaotic Indian democratic fashion, it really has to be bottom up as opposed to top down, because we don't have the incentives in place to do the top down yet. The insurance penetration will grow, but I think it's going to take some time for that to happen. But my hope is that we'll be very digitized even before that happens, just given the interest that is. Because the other thing, the other black swan event that has happened is the pandemic. And we've been talking to providers for the last 20 years about how they use technology. And what we're suddenly seeing is that, 50, 60-year-old doctors who've, never wanted to touch technology suddenly are coming out and asking for what kind of tech solutions can they use because they've been locked up at home and have needed to continue running their practice. So I think this is an interesting time. It's, the best of time and worst of times, but it's an interesting time. And I think we're making all the right steps, but it's really going to be bottom up, not top down.
Hey, Ajay, thanks for that. That I had is, as an alliance, you're working with various players. Now, what opportunities do you see for purposeful collaboration in healthcare? It could be between doctor and technologists, public, private. Do you think what works well today? Where are the opportunities?
So I think, and again, without tooting our own horn too much, what we've been able to do is we've been able to get private collaboration, right? So we have folks like Practo, we have folks like Apollo and Medanta. These are not, industry actors that normally collaborate so much. And the pandemic, again, has been a great push for people to really come and really be very, very generous with their time, really be very generous with what they bring to the table and try and solve for India, right? So I think that private collaboration is happening. And so there's layers of this, right? So you could also, there is also the fact that we have a public system that is today 25% of the care. And the question is, how can the private sector help that public system move forward? Maybe it's in terms of technology, maybe it's in terms of standards, maybe it's in terms of bringing all of these innovations to bear to the public system. And I think there is a good way for the public and private systems to work together, because at the end of the day, your frontline workers out in rural India are essentially public health workers, right? And if you can actually bring technologies and solutions and supply to the last mile, then it might help move the needle at that end without us thinking that it can just be a simple thin tech solution, but a tightly integrated solution across the value chain of healthcare. So to me, there is a lot of collaboration, not just between the public and private, but there's also collaboration that's needed between the organized and the unorganized healthcare sectors, because at the end of the day, there's frontline workers and they could be formal or informal, who are out at the last mile, who also need to be brought into the fold. So there's a lot of scope for collaboration. I think that's the only thing that can actually help build this kind of system that we want to build in India.
Great, Ajay. Michelle, have you, it would be great to get your thoughts on such collaborations that you've seen. either in India or outside India, from your perspective, working with an AI solution and working with the hospitals and the doctors?
Apologies. Digital, I think adoption is really, clinical collaboration is key to adoption of any digital health technologies. And we work very carefully in a clinic collaboration model to ensure that we're getting those experts contributing their expertise as well as their data and their knowledge about how technology is actually going to practically be useful for them, because it's great developing a solution that works in the US market or that works in the Australian market or Southeast Asian market. But at the end of the day, the incentives and the level of technology adoption and maturity is very different in those different markets. And as we've heard from the panelists, you know, the Indian market is quite interesting in that there's this really big divide between kind of the different levels of healthcare provision and the different levels of digitisation. And so when we talk about clinic adoption, it's really about understanding how can you collaborate and build products or collaborate with and jointly create products that are actually going to be of practical use to those different clinical care providers. And if you can't do that, and if you can't align the incentives, and if the price is not feasible, or if the products or the technologies aren't accessible because of lack of digitisation, they're useless. And so they're not going to benefit the healthcare outcomes of consumers within the environment there. And so we work very closely with clinics on a global scale. We've got a very strong clinic collaborative model. We've got an incentive model actually that any of our clinical collaborators actually receive royalties on commercialisation of those products, because what a lot of clinics understand and hospital systems understand is that in the context of technologies like AI, their individual data sets are actually not that useful because they're not diverse enough and they're only relevant to their particular institution. But as a collective, they're enormously valuable. And so why shouldn't you give back to those clinical data collaborators? And why shouldn't you build this collective kind of build model where each of these clinical collaborators are contributing, and that collective wisdom and the collective data and diversity is actually what drives the value of those products? And so we do that at a global scale. And what we found is that the incentive or the value proposition of our product, for example, is very different in India comparable to the US or Europe. You know, in India, the IVF clinics are really small. It's the highest density market for IVF clinics globally. But these clinics are only servicing a very small number of patients on average. And so what that means is that they can't afford expensive hardware. So if you've got a solution that requires a $200,000 piece of equipment, they probably won't buy it. They need access to good quality internet in order to be able to access this type of AI products. And so, you know, you just need to understand what type of model will work within the environment that you're operating in. And so that's kind of what we focused on. And we found that clinic collaboration is a really effective way of getting all of those incentives aligned, having the clinicians actually part of the technology development so that they understand and build trust in it, and so that the technology is actually oriented to their needs and will be useful for helping their patients.
Hey, thanks, Michelle. I think you spoke about the clinic collaboration, and Ajay mentioned about public-private, private-private, and the between the organized and the unorganized. I'm going to make a transition now. The quality. I think Shashank, you mentioned about digital healthcare and quality in a low-trust society like India. You know, where do you see and how do digital health driving quality and maybe outcomes in yeah, so if you could share your thoughts.
Thanks, Priya. And I think that there's we've covered a lot of ground on what we can really do with in quality. But I just wanted to double down and double dip into that. In terms of you know, we're thinking of health just from the point of view of you know, treating the symptoms, but you know, when it gets too late, you reach a caregiver and you get, you know, you're treating the symptoms, and and you're hoping that after you treat the symptom, the patient kind of changes their or his or her lifestyle, which actually kind of solves the root cause of the problem over the longer period of time. And if you don't do that, then you're going to get back the symptoms. So what digital can really do is it can not just bring in interdiscipline across different specializations, but also different industries. In this case, health is as much as about what are the nutrition that you're putting into you, which is the food that you're having, connected to the sleep that you're getting, connected to the the medicines that you're taking, and the fitness regime that you're having. So I think what digital can really do is, from an outcome point of view, is even connect all of these parts together, which hasn't happened so far, and allow more of a continuous care and a continuum of care, which not just solves the symptoms through the medicines but also calls the root cause of the problem through the diet of the person or the exercise of the person, and then actually bring all of them together in a very simple and integrated manner for the consumer, right at the touch of his fingertip on a mobile phone, to being able to improve the outcome. And if the data is now being able to pass between all of these care coordinators, it can really allow for 10x the quality. And that's when digital adoption on the consumer side will start going up, is when they start seeing outcomes which are 10x better than what they're getting right now. And so that is a possibility in the digital play. And the second one is on the affordability side. My firm belief is that beyond just making things cheaper, it's also about bringing preventive in play. And the only ones who are really incentivized, right? Even a company like Practo, I mean, if you do telemedicine, you're just again providing a provider to the consumer's need, but the right actor who is incentivized to preventing disease is the insurance, and be it the government insurance program like Ayushman Bharat, or be it the private insurance providers. They are the at least it seems to me like although I'm a biased participant in the ecosystem, it seems to me like across pharma, across diagnostics, across providers, the stakeholder that really needs to be incentivized is the insurance company, because they are the ones who are really pushing to keeping the consumers and the patients out of diagnostic labs or out of clinics and hospitals. So the question is, how can we incentivize them? And some of the recent things which COVID has really thrown up is how employers are being incentivized. The government is incentivizing employers, and even sometimes pushing them, not just the carrot, but also a little bit of the stick, to getting their employees benefits, of preventive benefits, right? And then pushing the employers to give more preventive benefits to their employee base. And I think these things can again be delivered digitally in a care coordinated manner, and can also drive better outcomes for the patient. So I think in these ways, digital can really incentivize. It can really help drive 10x outcomes on the medical side, but also make it more affordable by making it easier for the insurance companies. And one of the main reasons why insurance companies don't really want to come into the play, especially beyond the IPTs, because of fraud. Again, a big place in which digital can really come in and remove these bottlenecks for the insurance companies. And I think more the insurance penetration that increases in the country, I think it's better for us.
Yeah, and Shashank, there is already an effort going on between the NHA and IRDA, which is the insurance regulator, to come up with a simplified claim management program to ease the process for both hospitals and insurance companies. And thanks for sharing that, Shashank. Viren, would love to hear your thoughts about how digital health can drive better quality or health outcomes.
Yeah, Shashank has covered most of the major points, right? On a macro level, 100% of everything that he's saying is true. But specifically, what does it mean on a day-to-day level? Indian hospitals are extremely busy places. Indian doctors are some of the most overworked doctors on the planet. The average time that a doctor gets to spend with the patient will be 10 minutes, 15 minutes if you're lucky in the outpatient clinic. And so let's say the patient comes in, this is things that we have measured, the time taken for the patient to walk from the door to the chair, sit down on the chair, open up his folder, start pulling out files one after the other, then the doctor swapping through it, looking at it, and then he's running this little algorithm in his head. Okay, what's the thing that I need to ask next? All of that wastes time. And we found as much as 35% of the time that the patients are spending with the doctor is wasted in this locomotion and data exchange and just things that are not productive to the doctor's ability to empathize with the patient, to ask the right questions, and to build that kind of bond, as you want to call it. So the simplest thing would be if we were to digitize all of that beforehand. So in the time that the patient took to walk from the door to get settled in his chair, the doctor can quickly glance through a dashboard of everything that is going wrong with his patient right now. And so they can immediately get to it. That leads to a much higher quality interaction. So that improves the quality of the patient experience. Now let's talk about the clinical quality. The doctors, through their experience, tend to ask a series of questions. Are you overweight, a family of heart disease? Are you a smoker? And oftentimes you may tend to forget one or two questions that may be relevant to the case in hand. So if you were to ask, are you hypertensive? Are you on any blood pressure medication? These things may seem simple. It is not. Most patients don't really carry around a full working knowledge of every condition that they have at this current point. If, let's say, the doctor forgot to ask if the patient was hypertensive or if he was a diabetic, and when the patient was walking and getting his diagnostics done, and he just happened to get a heart attack at that moment, and when we were to triage him and start administering drugs, those drugs would have a very adverse reaction in the absence of us knowing what he is sensitive to and what he isn't. So these sorts of things which come under the headline of medical error, not negligence, just simple error, which is one of the leading causes of death in hospitals across the world. I mean, even in the United States, it is 10 times safer to go skydiving than to get admitted to a US hospital as a normal patient. And you can just imagine how much more difficult and challenging it will be for resource-constrained environments like in India. So the simple thing is implement a decision support system as part of the EMR. So it prompts doctors into asking the right questions, and if it detects an abnormal value, it can act as a trigger. This is not great technology. This exists in almost everything, starting from Google's autocomplete to every travel portal that will automatically suggest if you say, I'm searching for flights from Delhi to, and it just says Bombay, because 60% of all flights in the country are from Delhi to Bombay. It's figured that out. It's not that difficult to do it in our space. But obviously, step one has to be just get everyone on the electronic medical record. Then we can do simple things, and it builds up from there. Right? Once you start putting in the electronic records, you can start pulling in logic. Once you start putting in logic, it starts becoming intelligent. Once you start becoming intelligent, it can start taking over a lot of the work for you. So I would say, yes, quality ultimately is driven by people following a standardized workflows, following best in class, as well as having access to great medical management protocols from around the world. And COVID has been this great time where the whole world has been learning at the same time, and the protocols that we follow have been copied in hospitals across India. The protocols from other hospitals have been copied in Italy, in the United States. So there is this definite sense that when we collaborate together, and if we're all on the same common platform, it'll be a lot easier to do these things and learn as a species and be able to solve for a lot of the challenges in this world. So I'd say, yes, 100% these things can happen, but we have to take that first step.
Yeah. So Viren, your point about augmenting the doctor's capacity when, we have a shortage of supply of doctors, especially specialists, and it's, very spot on for the, I think, guide for entrepreneurs who want to develop solutions, and how can they weave these into the workflow of the doctors. Thanks, Viren. Ajay, do you have any thoughts on how you can facilitate or digital health? How do you see digital health driving better quality or health outcomes in India?
So, I think, again, leading on from where Viren left off, if it's 10 minutes at Narayana, then it is, between 1.5 minutes to 2 minutes in rural UP, right? And there is good data that shows this. I've sat in clinics and with a stopwatch to see how much time primary care doctors spending in some of these rural clinics, and it's 1.5 minutes to 2 minutes. It also, there's good data out there, which if people have gone and done primary care audits, that shows that the doctor's wrong on average 50% of the time. So to me, there's tremendous opportunity to augment the decision-making skills at the primary care level. I think the challenge is also finding a way to really mesh technology there, because if it's a minute-and-a-half interaction, then whatever we build that works there, any tech that works there needs to fit in really well. Because that's a very short interaction to begin with. Because we've also seen tech solutions and tech companies that have gone to and tried to digitize these last-mile clinics. Where I remember going, and this is early in the 2000s, I remember going into a clinic and an informal provider and asking him, and this was a clinic that was touted as digitized and connected to a broader center with decision support and all of that. And I remember going in and seeing a computer with a dust cover on it that the doctor's kid used, right? Because he realized that he spends a minute and a half, if he dials into this thing, turns this machine on and tries to figure out the answers, then he's suddenly spending 20 minutes of the patient and he's just cutting into the number of patients that he's seeing. So to me, there is, the opportunity has always been there. I think the challenge is how do you make this fit into workflows on the ground? And I think there is a lot more incentive at higher centers where there's a lot more margin involved. There's a lot more value in driving better outcomes. But how do you really do it at the primary care level? Because let's face it, right? I think from a cost benefit perspective, the best thing that we could do in India is to make sure that there's better comprehensive primary care available, and that will give us the most bang for the buck. And so to me, that's the challenge. And I think what we have now with cell phones, what we have now with the changing behavior is an opening and an opportunity. I think what I'd love to see is to see hundreds of different models that are trying to do this on the ground. And then see some of them succeed after this trial by fire, which is what we really need.
Hey, thanks, Ajay. I think given the time, I'm going on to the Q&A. And I'm combining questions and into themes and paraphrasing for the benefit of the panel. So there are a few themes that I see. One, this is popular. So what shifts in digital adoption have occurred because of COVID-19? Any changes in baseline? Maybe Shashank, you could speak about it. And Viren, I know you've mentioned a few things because of COVID. If there's anything that you want to add, that would be great.
Sure, Priya. In terms of COVID, of course, COVID has been an accelerator. We are connecting on a digital forum right now. I remember last year we were in a physical setting on a similar panel. And so it's certainly pushed even healthcare online. We've seen in telemedicine almost an 8 to 10x jump before COVID to post-COVID. On the consumer side, we saw close to about 25,000 providers wanting to do online consultation, enabling themselves to do online consultation in a matter of a month. We had thousands of doctors volunteering to give teleconsultations 24/7. Through the day and weekends and public holidays, during this COVID period. So we've seen a huge adoption curve, which would have probably taken many years, happen in a few months in both the provider side and on the consumer side. And this has also led to, because the teleconsultation is happening online, the prescription generated online, so which led to online diagnostics, online pharmacy orders being placed, which were of course fulfilled offline afterwards. So we've seen a baseline jump of multiple folds on that as well. And going forward, I think while the offline has also started coming back, and now we are seeing, at least in the clinics, we are seeing almost 100% recovery in terms of the footfalls. And in hospitals, we've been seeing close to about 80% in some most of the places, 80% plus being back, except for electives. Most of the hospital operations were, at least on our network, were back on recovery mode. But I think these changes on telemedicine side are going to be quite permanent. We have not seen these dip even after the lockdowns were opened up. So we're seeing newer use cases coming up where early diagnosis, symptom-led inquiries, increasing in nature. So these are I think trends that we believe will continue even post-COVID as well. Which I think which will be good for the overall ecosystem, that a new category of healthcare delivery, which is happening online, will spurn and will hopefully serve the country.
Hey, thanks, Shashank. Anyone on the panel want to add any points before I move on to the next question on COVID, impact of COVID on your?
I might just add one point if I can, Priya. I think the digital is kind of the superhighway that connects the world, right? And it allows every country in the world, no matter where you are, to be able to connect with technology and to be able to access and level up in terms of utility of technology. Of course, all those base level provisions need to be there, internet and data collection and all of that, but it really is the connector. And I think one thing that COVID has done is it's brought the world together through digital, because everyone's experiencing the same challenges. Everyone's sort of working together out of a sheer need. No one can be selfish in this environment. There's kind of been a great sharing and a great, I think, a greater appreciation of how digital technology can actually impact globally. And so I think, you know, all of this adoption of telehealth, they're kind of practical solutions, but I think they will be persistent because they've demonstrated how efficient the efficiency gains that you can get with technology and the ability to, I guess, upskill less skilled workforces, the ability to be able to get point-in-time information to make better decisions. And I think that's really important because, you know, globally, really, I mean, you know, India has very different challenges to the United States or Europe, but globally, we all have very similar high-level challenges in that population is aging, workforce is diminishing, technology is going to be needed to create efficiencies, to help in upskilling workforces, to help, you know, doctors make critical decisions in time-poor environments. All of those themes are very similar globally, and data and technology is kind of what connects them all. So I think the COVID situation has just created greater awareness and greater acceptance that this is the way of the world and this is what we need to kind of start working towards.
If I can just quickly come in there, you know, as a public health professional, I have to mention this, is that what COVID has also shown us, in addition to what we've seen in telemedicine and elsewhere, is how critical data is, right? So when it comes to control measures in India, we've essentially been flying blind, right? We've been flying blind because we haven't had good data at the micro level that could have, you know, allowed for smart lockdowns, that could have allowed for smarter non-pharmaceutical interventions to manage a pandemic like this. And I think the digital commons when it comes to health, I think is very, very important. I think we've all realized the need for it. And I think that's the other big shift, which I think is also going to be permanent, is we're going to think a lot more about, you know, how this data should flow and how this data should be available to policymakers.
Yeah, that's a great point, Ajay. I think we have time for one more question, so I'll pick this. What is the opportunity presented by digital health for a personalized healthcare experience? To what extent can it be personalized, and how can that be done in an elegant fashion? Maybe Viren, you want to, do you have any thoughts on that? And I could then go to Shashank and Michelle.
I'll actually defer my time to Michelle because I think her company does a lot of the work on the personalization of care. Michelle?
Yeah, I mean, technology has a great ability to be able to personalise, you know, whether it's trawling through large amounts of genetic data and understanding key drivers of disease, or whether it's understanding predictive, you know, response to new drug treatments. But what underpins personalised healthcare, again, is the data. And it's got to be good quality data. You've got to be able to leverage that data in a way that allows you to treat that patient on a personalised care level. So I think personalised medicine is definitely a theme of the future. It's being used in a whole range of different ways already, but I think what underpins that, and again, the critical determinant of success of personalised healthcare, is the data and the quality of that data and the ability to have the right insights at the right point in time to be able to personalise healthcare. It's actually quite a big challenge. So it's, yeah, it definitely a theme of the future.
Great. Anyone, and it needn't be in the healthcare delivery, but more a personalized care experience. Anyone wants to weigh in? Okay.
I think just to add one point, Priya, may not be there's certainly the use of data. Which, I think Viren spoke about how little time there is, and Ajay also spoke how little time that doctors have now. If data is collected in a much more longer time period, data about the family history, medical history, and it is collected in advance, it can really help the doctor and get more time on his hands. What we are also seeing that this data is also very beneficial to the providers. To give you some examples, let me talk about the fact that if data is if the right amount of data is collected and feedback goes back to the doctor can also improve his own delivery. And this is also very important. What we're seeing is that if every doctor wants to do his or her best, and some of it is about under the medical knowledge that they have, but also a lot of it is also about personal skills that they have, about how they're delivering this message, how are they handling the more softer aspects of things. So, we covered a lot on the quality side, but I also wanted to also add in the fact that this data, this feedback about the patient, it could be his patient's rating, or it could be patient's feedback to the doctor, that adds a lot of value to the doctor, and the doctor can improve his or her own delivery as well over the longer period of time. And just to one finer point is, healthcare is as much about the science, and also as much about the psychological part to it. So there are some patients who prefer doctors who spend more time with them. There's some patients who prefer more efficient doctors. There's some patients who prefer different types of doctors. So data can also bring that personalization back to the patient. Some patients would just want the doctor consultation just be 5 minutes, right, to the point, and they want to get back. But some patients would love to spend half an hour to 45 minutes with the doctor as well. So understanding which patients like what kind of doctors, and putting that back into the algorithm and showing them the relevant doctors that they can go to, has also we've seen a lot of benefits from that as well. So not just on the cost side or on the quality side, but also on the softer skill side. There's a lot that doctors can benefit, and also that patients can benefit from.
Hey, great, Shashank. And this has been a very insightful discussion. And any final thoughts from the panelists before we close, and I'll summarize our discussion to the audience.
Yeah, I'll just make a very brief point. The healthcare industry is the second largest industry in the world. It's around $7.6 trillion worldwide. And and that's the most amount of money people are spending on anything. And the entire world has shut down because of a pandemic, a health crisis, first and foremost. So whatever healthcare systems are around the world, whether it's a developed country or a developing country, is simply not working.
Yeah.
Because if we cannot take flights, if we cannot go to our offices, if we cannot attend schools because of a virus that's floating around and may possibly be in the atmosphere forever, it just means that the healthcare systems are not equipped to handle that. And so we have to, not just 10x the digital technology, we have to 10x our thinking about how healthcare systems have to evolve. And without adopting digitization, we will simply not be able to transcend these old ways of thinking that people need to come to a hospital for everything, or you need to take medicines for everything, or you have to know your doctor personally rather than, text with him on the phone. So these behaviors have to change. Otherwise, we're simply not going to be able to cope with the next pandemic.
Thanks, Viren, for that. Any other thoughts before we close this?
Can I just add one comment to Viren's recent comment, because it's really critically important comment that he just made. There needs to be upfront commitment to the strategic long-term benefit that technology is going to bring to the healthcare system. And there's a lot of work to be done. There's a lot of upfront commitment with little return, but the health economic returns will play out in the future if the technology adoption is there and if the infrastructure is there to be able to build that. And I know just in the AI sector alone, this is a really interesting stat, but the health economic returns compared to the spend on AI technologies is around 5-fold, and that's in health efficiency and outcomes. It's enormous. You cannot do this without technology, but there needs to be the upfront commitment to collecting the right data, to putting the right systems in place, to getting collaboration, to building the infrastructure to facilitate those technologies, and that's critically important.
Hey, thanks, Michelle, for that. Ajay, Shashank, anything from you?
Yeah, just leave Ajay the final word. On at least for the pandemic that we're facing, the silver lining has been digital health. It's to be very honest, it's gone from something that's in India, at least in the context of India, from something that's nice to have to being the mainstream right now. Before the pandemic, the amount of time that just the difference in the time that the government spent on digital health has tremendously increased, and it's brought digital health right into the focus. So I'm like they have a saying in Hindi, "Do hota hai, achhe ke liye hota hai." So just to convert that to English, whatever happens for a good reason. And I think just seeing the silver lining of what's happened is that in the future we'll hopefully be more digital proof. We'll have some of the learnings that we have seen in this pandemic, and to counter the many more pandemics that we will see, and it'll make healthcare and the society more robust and more resilient to fight a pandemic like this in the future.
Yeah, so I think that I completely agree with Shashank. I think that we need to, and this has been like I said earlier, it's the worst of times and the best of times. We've lost frontline workers. I've lost colleagues. I've lost people that I've worked with, teachers in the past in my medical education. So I feel like there is, this is a trial by fire that the health system is going through, and the health sector in India is, dealing with a lot right now. Smaller hospitals have been shut, practices have been shut for a while, and while all of that is happening, you also have this growth of digital health, and I think that it's really a call for us to really start thinking about how we reimagine how our health system should work. And I think while this devastation has happened, it's also an opportunity. And that's really what I would focus on right now.
Hey, thanks, Ajay, Michelle, Shashank, and Viren for this great discussion. I think we covered a variety of topics, right, from the potential of digital health for care coordination and affordability, accessibility. We also spoke about better health outcomes and quality for digital health. We also spoke about what we need to be cautious about in adopting these technologies. I love the example of the Ferrari, and being a Bangalorean, I can connect to that. And Michelle's point about data being available for AI technologies. Shashank, you spoke about the integrated experience that digital health can provide across preventive, the cure part, and post treatment part. Ajay, loved the insights on how a not-for-profit alliance can bring about more collaboration in the ecosystem, and also the point about because of COVID-19, we are getting better at measurements of data. Across all of you, for entrepreneurs especially, I see, or anyone wanting to develop a solution in the healthcare industry, the need for making a user experience 10x better, the ability for that solution to make business sense for the decision maker or the consumer of the product, the ability to weave in those solutions into the workflow. I think those were great points. I also loved the point discussion that we had on last mile delivery of healthcare, and there were a few topics which, if time had permitted, would have loved to go more in detail. Especially how can we train caregivers with the help of technology. Overall, great discussion, and thanks for being here, and thanks for your time.